Hey, Dental Nachos crew, welcome to our Balancing Compliance and COVID Protocols with my good friend, OSHA trainer in our office and key resource, Linda Harvey. Linda Harvey is an awesome person, amazing resource, someone who will make you feel calm in a sea of uncertainty and crazy things going on. So I'm going to read Linda's introduction, the way this is going to work. One of my favorite phrases, you can use it for new systems in your office. The way this is going to work, we have to change our mask. The way this is going to work, we have to take temperature checks. So the way this is going to work is Linda's going to deliver some content. And then if you're here in our Nacho Zoom CE on TV program, you can ask questions. I have questions to ask Linda. We'll have a Q&A. This is an awesome thing for your team to watch in on, your hygienists, your assistants to get some updates here. So balancing compliance and COVID protocols with Linda Harvey. Summer temperatures are soaring and so are tempers. That's very true, especially when it comes to wearing or not wearing masks in public or even dental offices. Maybe you or your team and your patients are experiencing COVID fatigue. How do you balance compliance and COVID protocols and still stay energized, compliant, and sane? Great points, Linda. The first step is to think like an athlete. Shift your mindset from that of a sprinter to a marathoner. Such a shift requires us to think more long-term about sustaining the newly implemented COVID protocols. At the same time, we must not forgo routine compliance requirements such as annual OSHA HIPAA training, updates to policy manuals, and conducting regular bona fide security risk analysis. With that, I'm going to welcome my good friend Linda. Thanks, Linda, for being here on Nacho CE on TV.
Well, thank you, Paul. It's a pleasure to be here. It's always good to see you. I know we can't be in person these days, so it's fun to connect with everybody on our Zoom and different meetings. So happy to be here.
And I think you're a pioneer like me too. We've been using Zoom to share information even before a pandemic. We're going to use it after. So just the mere fact what we're doing now to share with your team is great. So I'm going to turn the floor over to you. I'll be behind the scenes. If you need me for anything, let me know, and then we'll have a fun Q&A whenever you're done with your presentation.
Fabulous, Paul. Thank you.
Thanks, Linda.
Good afternoon, all our dental nachos. It's a pleasure to be here. I have probably about 12 or 14 slides, and then we'll be able to take a Q&A. We'll have plenty of time for that. So as we get started, I just wanted to first mention that, let's see, we get our slide going here. Where are we with get our protocols going here? First, you have to get the computer in order, right? Quick little disclaimer. I am a sponsor of Dental Nachos. Love them. Thank Paul, A.K. Nacho. Dr. Nacho is fabulous on all the work that he does for our profession. This is an informational program. I will give you straight up information as I know it from the CDC and other credible sources. When I'm giving you my opinion, I will definitely let you know this is the Linda Harvey opinion, and that is not a legal piece of advice. It's more risk management or just best practices sometimes. And I do own and operate 2 compliance-related companies. So this will be sales-free, but we will talk about some great information along the way. Paul just read our goals to you. We are going to reframe these risks and benefits of compliance. We'll talk about current protocols for you with COVID and that marathon mindset. What does that mean for us? And then identify some specific techniques for staying abreast of changes, not just through our great forums with Dental Nachos, but other areas as well. And last but not least, let's kind of look at some self-care tips to take care of ourselves through all of this. You know, I saw something very interesting recently, and that was that self-care is not selfish. It's about taking care of ourselves and making sure we stay healthy as well. You know, over the past few months, there's been a number of conversations on the Dental Nachos forum about the difference between guidelines and guidance and what do we have to follow? What do the regulations and the laws say? And so that conversation aside, but I'm bringing attention to it at first because those are areas that confuse us. We're trying to figure out what the best practices are. So I'm going to draw some different framework around that for us in just a second here and talk about how we reframe conversations with our patients all the time. You've seen a number of great posts and articles from Dr. Nacho regarding how to present cases to patients and use different languages and different questions. You know, we no longer talk about costs. We talk about the investment the patient has. You know, we have different language with the patients. I'm not thinking of it now, Paul, but I'm going to ask you to bring it back later because there was one really important phrase that you used about it earlier this year, beginning of last year. It was really amazing about how do we elicit questions from our patients. Instead of saying, do you have any questions? It's what questions do you have about implants? Or, you know, being a little broader in sense. In addition, we're also thinking about the fact that, you know, how are we addressing questions from patients right now with COVID? I was in a forum recently on Dental Office Managers Forum, where one of the questions was, now our patients are interviewing us. They're wanting to know, what do we do for COVID protocols? When have we been tested? Has anybody in our office been tested positive? Have we traveled anywhere? So that put the shoe on the other foot, didn't it? So being able to have these kinds of conversations is extremely important. And so let's talk about reframing compliance and COVID protocols as well. I'd like to use a mindset of a sprint versus a marathon. And that is, here in Florida, we were pretty lucky. We were only closed for 6 weeks. And so most of us could think, we've got this deadline in place. We knew it. And actually, our governor opened our state even a week earlier than we anticipated. So we were pretty, oops, sorry, going backwards here. We were, let's see, no wonder, hold on. I've got my magic decoder ring here for my slides, and it took a mind of its own. So in Florida, we were pretty lucky. We even opened a week earlier than anticipated. But some states weren't quite so lucky. It took you a number of months before you were able to leave that closed state in which you were seeing emergency patients to some degree. And then we got to the reopen, or as Paul says, we were less closed. And then finally, last but not least, we are back open to some degree, seeing patients maybe close to our regular patient schedule or somewhat close to it. So when you think about the mindset between a sprint and a marathon, we thought things would be back to normal or figure out our new normal much sooner than we have now, didn't you? That's what I was hoping for. Maybe I was a little bit Pollyanna about that, but nevertheless, we want to be optimistic. So when you're training for a sprint, your mindset is much different than that of a marathon, isn't it? You probably would hire a different trainer. You'd have a different training program. You may have, just a total different mindset, because we're in this COVID situation for the long haul. It's not just, what do we need to do for the fall? Let's get the kids back to school. Things will be better. That's not going to solve it. It's not going to get solved when 2021 kicks off. We just are in this whole new era for the long haul. And some of the processes that you've implemented in your practice, doctors and teams, those are things you're going to keep for a long time. I'm sure your patients are going to enjoy, in your front office team, the fact that you have less paper, things are streamlined. Some of those processes we stripped away that we probably didn't really need. So now we're looking at streamlined practices, and it's totally changed the way we're thinking about things, because the goal for a marathon is much different than that of a sprint. Because right now we don't have an end finish line in mind. It's going to be ongoing, because yesterday, today, and tomorrow, I've been attending the OSEP annual virtual conference, the Organization for Safety, Asepsis, and Prevention. I took some time out from lunch to join you all today, and we're hearing things about, what's happening with, around the globe, what's going on with the vaccinations, what's happening with all of our new infection control protocols and from the CDC, as well as what's happening with, the technology that's being evolved and how we can be better prepared. And this preparedness is so very important, because in the past, when you think about hospitals being prepared for emergencies, what they've been focusing on the past couple of years have been mass casualties, hasn't it? Not so much a pandemic like this. So even though this pandemic, as we all know from our conversations on DM, the mortality rate is not killing very many people, but yet it has been an extreme disruption and has caused extreme changes in our life. And the fact that viruses don't have a passport, when we hear about something going on in some remote part of the globe, no longer can we think about that being far away and doesn't impact us. So our whole mindset now is really evolving with this. So I want to bring it back down to what's going on in our country and what do we need to look at to reframe our thoughts. First and foremost, as employers, myself included, OSHA tells us that we must follow the general duty clause. And in a nutshell, this tells us that all employers have the obligation to furnish their employees a place of employment that's free from recognized hazards that are likely to cause serious harm or death to employees. And so you may say, okay, all my electrical outlets are all clear. I'm safe from, that kind of thing. We don't have trip hazards. We have locks on the doors. We have security systems and so forth. But, even though there's not a high death rate from COVID, that is a known hazard. And so OSHA could exercise their right at some point in the future when they get back to work, when they do investigations or response to complaints, they could use this duty clause to show us that we need to improve our processes. And I think we're moving in this direction already. A couple of areas in specific, though, are thinking about looking at reframing our processes, our mindset, excuse me, as I want you to think about your insurance policies and compliance. And I just saw a great post today from someone who is a traveling dentist or mobile dentist and was looking for the right kind of malpractice coverage because her current carrier wasn't going to cover her for all of her full services. So these are the types of things that are evolving, right? The new models of dentistry. So we think about employment practices liability for one. When you have that type of insurance, that carrier is expecting you to be in compliance with the employment laws, have customized policies and procedures, have good compliant hiring processes, which you're not discriminating, you're hiring appropriately and fairly, you're following federal and state laws, and you have written job descriptions. Those key items show that you are doing what's called behavioral-based interviewing, and that you're hiring someone based on their experience and their what's the word I'm looking for? Their strengths, as far as the characteristics that they bring, experience, and the strengths that they're bringing to the practice, the behaviors that you need for those jobs, duties, and your job descriptions. Sorry, I got a little tongue tied there, but I think you get the idea that they have to be compliant with this for this policy to even cover you. And then when it comes to your cyber risk carrier here in coverage, think about this. And Paul and I have had this conversation in the past. HIPAA compliance, that's what your cyber risk insurance is covering you for. The cybersecurity piece, what happens if you have ransomware or something happens where your data gets stolen or you break into your practice and someone runs off with your server, for example. Again, you must have customized policies and procedures that cover your practice and not something that's cookie cutter. Let's talk about policies and procedures for a minute. I think I've shared this little 90-minute video on DM before, but just to kind of recap a philosophy that I'd like to share with you. Your policies and procedures are like your patient record. If it's not written down, it didn't happen, right? It cannot be cookie cutter because you do not provide the same care from one patient to the next, even if it is a routine prophylaxis or a single unit implant or whatever the case might be. Every patient is different, and you would expect to see some different aspects of the notes, even though the core things could be the same if it's a similar procedure or the same procedure. Same thing with policies and procedures. Those must be customized to your practice and be filled in. If you've got blanks, have you even read them? Some of my key words are, what does our policy say? When we look at something in the office, we have a question about our HR policies. What does our handbook say? What are we supposed to do with release of information when we can't answer a question? First and foremost, do you go to your policies? Do you know what's written there? That's what's going to protect you. Just now, we're working with a large group here in the Southeast. They've got over 30 offices. They recently had an OSHA complaint. And the complaint is, there's not a policy and procedure in place for respiratory protection, that they're all wearing respirator masks. So you see, that piece of paper, that document, that policy is what's going to protect you in any kind of legal inquiries. A second thing to bear in mind with HIPAA compliance that your cyber risk carrier insurance is looking for in order to cover you in any of these risks is that, have you done a security risk analysis? A bona fide security risk analysis. That is not a checklist. It is not something that your IT company provides for you, although they can assist you, and it must follow the Office of Civil Rights guidance document on how to conduct a credible security risk analysis. And then after you do that and you find out where your weaknesses are, like for example, maybe you haven't updated all your workstations to Windows 10 like we were supposed to, maybe budgets, COVID, things have gotten in the way, right? But you must act on those security vulnerabilities as soon as possible. Because a couple of years ago, the OCR came out and stated that when there's a breach, they will be looking at the previous history of compliance of the covered entity or the business associate. So one of the things that we've done is that we are now audit your IT company to be sure they are compliant. We have a 3-page questionnaire. We make sure that they're following their legal requirements and obligations under the security rule, the HITECH Act, and the omnibus rule, just like covered entities are supposed to follow. So you can see now, compliance is very broad, and it doesn't just permeate, where does the next PPE come from? What does the CDC say? Yes, that's our forefront and on hot burner right now, but we don't want to forget these underlying foundations of your practice. So let's switch into what is going on with the CDC. I've got a couple of slides that will talk about some of the high points here, and then can't wait for some Q&A because I know this group is always very intriguing and engaging. So one of the things that changed now for both patients and staff is the threshold for temperatures. It's now 100 degrees Fahrenheit, whereas before it was 100.4 degrees. And the reason this was changed is that aligns our guidelines for dentistry with some of the other CDC documents. Evidently, it wasn't all consistent, unbeknownst to us, perhaps. So it's either 100 degrees or it's a subjective fever. And subjective fever is kind of a subjective interpretation, perhaps, because we think about that in our SOAP notes, subjective. What is the patient telling you? What is your staff telling you about how they feel? Not every fever is COVID related. It could be related to someone's dental condition, an infection going on. It could be related because someone has strep throat or something else going on. But it is a first indicator that we want to start monitoring signs and symptoms. So doctors, if you or one of your team members develop a temperature, then obviously they shouldn't come to work if they know it beforehand. But if it evolves during the day, they should be going to see their private practitioner to determine, is this COVID or is this, strep or some other maybe sinus infection going on? The CDC now says explicitly to document the absence of symptoms that are consistent with COVID. So I'm going to recommend that you do so in your patient record if you have not already done so, okay? So that means that we're looking at your process for your remote screening, like let's use Weave, for example. You can send out that text message, the patient can respond to the screening questions, and then what do you do with that form? Where does that form go? Does it go automatically into your practice management software? Does it take some manipulation? Or have you created perhaps an auto template note in your electronic record and you have notation there of what the patient's temperature was and that there was absence of symptoms consistent with COVID-19? Let's take a moment and talk about workflow here. With the workflow process, I'm aware that one of my clients uses Weave and they love it. It works really great. It's a good product, good service. It saves that questionnaire in a PNG format. So if you don't want to take time to convert it to a PDF and then import it into your patient software system, then you'll leave that document with Weave or you'll download it and store it on your server elsewhere. So it makes it even more important then that what you have written in that patient record is very important, because if you should ever lose those PNG files, maybe you put them in a place in your server and it becomes corrupt or something happens, it gets saved over, anything could happen. You want to be sure you have that documentation in place. And then this is more from me than CDC, but be prepared for questions from patients. As I mentioned earlier, this was happening in one of the forums and it's not the first time it's happened. So be prepared to be screened by your patients. And I will never forget an article that I read by another compliance consultant named Karen Daw. She was talking about how she was trying to find a new dental home for her mother. And along the way, as she was making calls to practices, she was practically being hung up on because the team members didn't know how to respond to her sterilization questions. So we don't want that to be the case in your practice, because as you are continually working hard to set yourself apart, be unique, in your community and be outstanding in your care, that's one way you can be outstanding. It's for all team members to be able to converse with patients and talk about your sterilization or your disinfection procedures. Does the front office team need to go as deep as maybe a clinical person may? Not at all, but at least to be able to acknowledge what a great question, Mrs. Smith. We are very proud of our practices. I can answer some questions for you. And then if you'd like more information, I can have you talk to one of our clinical team members. It can be something as simple as that, so that way you're coming back with a great response that's sincere and accurate. So let's talk about this whole N95 mask situation again. Okay, I'm going to open up a can of worms here today. Probably we'll have a lot of conversation on this, I'm sure. But here's what's changed.
We love some good N95 drama. So I'm ready
drama. Drama.
It's like a middle of the day soap opera. So I like that. When you're on school, so
we'll be better than the young and useless. We'll be better than the young and useless. Okay. Thank you. Yeah, that's perfect. So now what's changed in this August 4th document is that there are 3 categories that are recognized as far as your transmission level. Sorry, my fax machine is going off. If you can hear that, please forgive me. Find out, it's important now that you all know what level of transmission is going on in your community. Do you have no to minimal transmission? Do you have minimum to moderate? Or do you have substantial transmission? Because that determines what you need to do with this mask. So no to minimal transmission means that you have isolated cases of COVID that are limited in community transmission. There's some investigations going underway, but no evidence of exposure in a large communal setting. Like there's no outbreaks in schools, there's no outbreaks in businesses, those kinds of things. The minimum to moderate means that you've got sustained transmission, and there's a high likelihood of confirmed exposure in communal settings, and there's a potential for a rapid increase in cases. I would say that's probably at least where Florida is sitting, and probably we're over there on the substantial transmission. I meant to look at our numbers this morning to see exactly how we're doing, because Florida's been the hot spot now for more than a few weeks, I think. So last but not least is that substantial transmission, large scale community transmission. So what CDC says is that if you are in the no to minimal category and you can wear a surgical mask when you're performing aerosol generating procedures, you must have eye protection, so there's no gaps like your prescription glasses would be between your glasses and your face. And then, of course, you have your gown and your gloves. So let me repeat that. The eye protection, pardon me, the surgical mask is okay. So level 3 would be okay if you can show that your community has no to minimal transmission of COVID. So what I would encourage you to do, and I've seen this, and there's a document from the Virginia Dental Association, and I'll address those new laws there in just a moment, where you're able to keep track of what you've checked every week or every month, whatever your frequency is, so you can attest to and show that you've made a good faith effort in making sure that you know your transmission rate in your community. Next is this minimal to moderate category. This requires, of course, the eye protection that I just mentioned, but this is the category that requires N95 or higher during aerosol generating procedures. So what we have here is, I'm not giving you permission not to wear an N95. What I'm telling you to do is, according to what the CDC is saying, is know what's going on in your community. Look at your public health department websites. Call them if you're not sure. Find out what the transmission rate is. Maybe you have patients that work for the health department or epidemiology, or even someone in infection control in a hospital or surgery center is going to be tracking this, because it's required for them to do so for their accreditation status. So you have resources at your fingertips. You know that old saying, we're only just a few degrees away from someone that we want to be in touch with. So track what's happening and document that you're tracking that. So and I can tell you right now that there are more opportunities now to get N95 masks than ever before. Our friends at Ballerina Solution have access to a great N95 mask. And as a matter of, because you've heard me promote them on DN website, Facebook page, right? They've been very consistent throughout this whole process. They were on top of having KN95s. They've got face shields. The owner, his wife is a dentist. So he's really in tune to what's happening firsthand to our PPE situation in this country. And now they have a reputable N95 mask. As a matter of fact, I think they've just become an approved vendor with Patterson Dental. So you may see their mask, it won't be sold under their name, of course, but it'll be named whatever the name of the mask is. So this is coming, we're coming, and we're very close. And this morning, in one of the great panel discussions on the OSAT meeting, one of the things that was spoken about by the head of Henry Schein Company, Stan Bergman, was that we have to get a grip on, and the grip is my word, we have to get a grip on what's happening with our PPE. And this is not just for us in our country, the richest country, the best, who's got the most money to hoard all their PPE, but this has to be a global situation, because we know, as I mentioned earlier, viruses don't have a passport. So if the poorer, less developed countries don't have the right PPE, sanitizer, soap, things they need to stay healthy, then that's going to impact everybody globally for some of these viruses. So bear in mind, these are the 2 differentiating factors. We'll come back to this during Q&A, okay? So let's take a deep breath and transcend over to HIPAA now, okay? Let's talk about that security risk analysis a little bit more. I alluded to some of the points earlier, but let's talk about what it says. The federal law, the security rule, says that you are required to conduct this security risk analysis periodically or whenever there are any changes in the environment. I don't know about you, but I bet your practice doesn't go an entire year without some kind of changes. Is that turnover of employees? Is that updating software? Is that adding new hardware? Is that some kind of change, a build out, a move? All kinds of things are happening. This document will be requested to be produced if you have some kind of breach or ransomware. So it's very important that you have done this analysis. And as I mentioned a little bit earlier, it is required for your cyber risk insurance. Doctors, if you participated in any of the federal funds a few years ago under the Stimulus Act, then you receive money to buy computer systems and up your game when it comes to using electronic records, then you have to be compliant with what's called the meaningful use section of that law. And that means that you're required to do a security risk analysis every year. As a matter of fact, we're working now with a consulting company in California who helps her clients. She's a medical dental billing specialist, and she does some other HR implementations, EMR implementations, electronic medical records. And she has a number of clients that need to have this security risk analysis to meet California law and federal law requirements. And in order for us to become her vendor, we had to submit to them not only just an outline of what our report would look like, we had to send them, a table of contents, a whole description and an outline of what our report would be like so we could be approved by the state of California for these auditors. This is a really big deal. So if you are not a Medicare, Medicaid provider, this probably does not, encompass what you do. Because when that federal law was passed under President Obama's administration, that was intended for healthcare providers that are Medicare and Medicaid providers. So physicians, normally that's almost all of them, not so many in the dental world. But bear in mind, you could fall into that category if you do. And then please be aware of what your state dental practice act says. There are some states that explicitly state, and I believe Virginia is one of them, that you must be in compliance with the HIPAA federal laws. So this would be part of that too, that could then come into play, that if you had an issue, it could impact your license as well as impact your practice and fines from the federal level. A security risk analysis is not a simple checklist. It's not a review of your network by your IT vendor. It's good that they do that for you. You want them to, they're your partner. Well, what we're finding with a lot of IT companies is that many of them are so focused on their infrastructure and what they do for a living, they're not all thinking like hackers. So we're finding situations where the two-factor authentication is not turned on, for example, when it comes to remoting into your practice or when you're remoting in yourself. Simple things like that. And this is not the same thing as your PCI compliance. This is different. They are overlapping, but it's not entirely the same thing. So credible security risk analysis, as I mentioned, it meets the guidelines set out by the OCR. It has things like a list of your media and devices that contain all the protected health information, the PHI. You've done a thorough and credible threats and vulnerability assessment. You create a security risk management plan after that, so you know what vulnerabilities you need to improve to close the gaps and make your practice safer than before. One thing that we recommend having done, and we do this for our clients, is an external vulnerability scan. It's a simple scan of your IP address to make sure that the ports are filtered and are in stealth mode, so that way you're a little bit more difficult for those hackers to find you. Well, I like to use an analogy here of that with our home. We have home security. You may have Ring. You're following what's going on at your home on your smartphone, right? You wouldn't leave one evening and go out for dinner and leave all the lights on and the blinds open and the windows open. But that's what it's like at your practice if you don't have the ports filtered and in stealth mode like you need to, just to be protected. So they have to be open because that's how you communicate, but they have to be protected. So I hope that makes sense. What I'm going to just stop here for a moment and maybe Paul, let's do this. When we get to the Q&A, let's go back. Let's do the Virginia laws then, since I didn't do it in the OSHA section there. So we'll do that. I'll come back to them. And we're almost there. I just have one more slide, I think, after this one. So I did mention in our objectives that we would talk about some ways to stay in touch. The CDC has newsletters. Did you know you can sign up for those? You have great resources already through the ADA and your state associations. They are primary resources. I know that. But you can also, if you're interested in learning more yourself and reading things from different sources, the CDC newsletter is awesome. If you simply do a Google search with the words, letter CDC newsletter, you'll come up with this URL there, and you'll be right there and can pick and choose which newsletters you want to sign up for. Are you able to sign up for a newsletter, or do you get newsletters from your dental board? They don't send them out here in Florida anymore, so that's not one way we keep up, but we have something called an interested parties mailing list. I contacted the board years ago, so now when there's a meeting or a change, I'm on that email list. Iowa does that, for example, and so do other boards. I mentioned earlier about OSAP, the Organization for Safety, Asepsis, and Prevention. That is going to be one of the must-have organizations in your practice for membership and staying abreast of what's going on with infection control. The standards are changing rapidly, and this organization is a global leader in infection control. This is a nonprofit, membership-based organization where there's a partnership between members like myself and companies, PPE and big companies, Shine and Patterson and Benco, all the big companies that are all members and supporters of OSAP. Where this comes into play in your practice is the fact that the standards are changing for being able to implement policies and procedures for your infection control practices and making sure you've got those in writing and that everybody's been trained on them. That's not a law right now. That is a best practice. I will say that it is a law if you practice in a state where the CDC guidelines are written into your Practice Act. New Jersey, Pennsylvania, Connecticut, South Carolina, Georgia, Alabama, Arizona, and a number of others. So that's very important. If you're not sure, then I recommend you take a look at your Practice Act and look for that information. So you have to be in compliance. What's great about OSAP is that they have all kinds of information available at your fingertips. They're going to have their finger on the pulse of a lot of changes for you. Their newsletter is awesome. So I would highly recommend that, because when you're looking at training, onboarding new team members in the future, and it's coming because it's already started, training on your infection control procedures is going to be one of those new hire must-haves. This is not a prediction. This is upcoming changes. This is more than just a trend. OSAP has partnered with the Dale Danby Foundation, and they've created some credentials for infection control and dentistry. That was all in place and all launched pre-COVID. But you know what? Since COVID, they've had more than 600 people take those courses alone this year. So when you look at how things are changing, that education is so very important. So I'm kind of sorry to harp on that, but I just really believe in that. So I do have a membership discount. I don't know who signs up. You just can take advantage of it, but it's Linda, all caps 50. So if you want to sign up for a membership, it's 50% off at that. And I would highly recommend that you do that. So Paul, that's what I have. So what I'd like to do before, as you and Ariel get queued with questions, I'd like to make a couple comments about the Virginia's practice law, the Virginia law, not the Practice Act, that went into effect recently. So this is the first state that has promulgated any statutes and any statutory requirements for all employers about having an infection control policies, having an incident response plan, how you have social distancing happening at work and the break room, and how you're managing everything in the office. So this is very important. So if you practice in Virginia, I'm sure you're aware of that. We can put some things up this afternoon, or probably this evening, Paul, because I'll be going back to the OSAP meeting after this. But we'll have some more resources for you on the DN Facebook page so you can keep up with it. Or if you happen to practice in Virginia and you already have that information, why don't you post it for us? And that way, we can share the information. This could be the beginning of a trend in this country. I don't know yet. I can't speak for all the other states, but it's going to be interesting to see. Virginia was already one of the states that had adopted the CDC guidelines as law, and now it's adopted even more stringent. Now, these, I believe, are interim. I believe they're only, is it 6 months? I'll have to go back and clarify on this point, but I think it's in place for like 6 months or some limited time period. But in the meantime, though, it's important that doctors, if you practice in Virginia, that you get in compliance with that as soon as possible. So that way, if there's any complaints or concerns, then you'll feel covered. I didn't print out the law and I don't have any more of that memorized. I do have a copy of the VDA guidelines and whatnot. So I have some information that I've been working with for our clients there to bring them into compliance. Paul, I'll go ahead and bring the screen down, and I see the chat window we've got some questions maybe there.
Sure.
But, let me
awesome.
unshare, and then I can bring this back up later if anybody has any information they want.
Awesome, Linda. So that was just such a great 30 to 35 minutes, which is awesome. We're going to have this recording available because, OSHA, HIPAA, it's not, it's fundamentals of protecting ourselves. I have some questions here, some from the chat. You were kind enough to share, how do I ask this question? I use it for finishing hygiene exams. So, do you have any questions? People want to say no. So say, what questions can I help you understand about? What questions can I help you understand about your teeth, your gums, your insurance, the mask situation? Most of the time people will follow protocols in your office, like coming in with a mask, but sometimes it's the ones who don't will stick out, so we, same with our team members. And there's just been a lot of changes to an already frustrating, as you put in your great intro here, topic. So we went over the Virginia laws, Linda. I wanted to ask you, because we have so many different people in dental nachos at different ages and stages of their career.
Right.
And sometimes we say to ourselves, today is the day I'm going to start my diet. Today is the day we're going to. Now, it's not always the best way to make changes, but let's go with this. Let's say someone's doing a startup dental practice. They're about to open on September 1st. Okay, doing a startup dental practice. Another key resource and sponsor I have to thank for knowing you is Jamie Amos. So he does startups, right? I only know you through Jamie.
I just talked to one of his new dentists this morning.
Yeah. So let's just talk in a positive way. Walk us through the fundamentals of how you would train for OSHA and HIPAA, use yourself as the example. And there's other people who do what you do. We have multiple OSHAs, HIPAA sponsors, but if someone's going to do an implant, I'm just saying, someone's doing an implant, I could do it. Periodontists could do it. Someone else could do it. But I'm going to say, first step, take 3D X-ray, plan case. Second step, make surgical guide. Third step, place implant. Fourth step, restore implant. So walk us through some of the fundamentals of protection. Even if they're basic to you, Linda, they may not be to our audience.
Okay. Well, the first basics, Paul, is an awareness. All the doctors that we've talked to do have an awareness that they need to have some compliance. And many of them have worked both in corporate and private practice. So they have something to compare against of what was good, what could be better. And so having that awareness that they need to have something done is important. And then talk to somebody, because buying an off-the-shelf manual where you're going to fill in the blanks, sure, that's the most economical means when you've got a really tight budget. And we know that when you are starting a practice, your budget is extremely tight. But when you cut corners on compliance, you're beginning to set up a stage where you're teaching your team to cut corners on compliance. And then long term, that's not the value that you want to promote for your practice. So being prepared is been really important with that. So part of this comes in planning well before you open. And I'll use the Jamie Amos team, for example. So when we talk to one of their clients, maybe, they're still 4 to 5, 6 months out, we're talking about items now that we can help coach them on during the buying process related to infection control. So I'm going to add that into the conversation as well, Paul. So planning ahead, it's a lot more than just, oh, I need an autoclave, I need an ultrasonic, I need a sink, I need some cassettes, or I need this many instruments. It's a lot more than that. Coming together with the whole design and coming together with a future plan. Because believe it or not, I think that more offices are going to have instrument washers in the future than we've ever seen. So if you're planning a practice now, and I think you did some remodeling last year, I was supposed to come see it this year.
Yeah, I know. COVID.
I have to get Dawn to send me some videos.
Yeah.
So planning for that for the future. It may not be in your budget right now in startup, but think ahead. That's the first thing I would do, is think ahead for your sterilization and your infection control practice, part of your practice. Where would you have plumbing? Where would you place it? Just get that part right out of the bat.
And I think one thing I want to pause you. I know this is going to be an awesome answer with Jerry, but one of the things I want to share when you talk about Jamie Amos for startups, my good friend and my own dental focus attorney, Rob Montgomery, Linda Harvey, what I never realized, and even not until sometimes a few years ago, how your Linda Harveys or your Rob Montgomerys, they're an ongoing part of your team. So it's not like you do this once and you say, okay, Linda, check back with me in 10 years, or Rob, it's these, you have acute questions you just don't know the answer to. It can be legal issues in your practice and OSHA ones, because our team is constantly connecting with you. And that's another reason, because if I use this for owning a home, you need a plumber. My awesome Kate, his husband is a plumber. I think she might be still watching on our vacation with us. You need a good plumber. And if you have a problem and you don't have a relationship with a plumber, you might not be able to get to ask one. So you're talking about creating a foundation, let's pretend there's no such thing right now as COVID, which would be great. Just pretend, and travel's easy. So now let's talk about you're acquiring a practice
Okay.
and you want to bring in a Linda Harvey, and I'm representing you as, how do you work? Do you come on site? Do you do virtual training? What would the team need to expect? Because I know there's a lot of dentists saying it's going to be too much for my team or do this. I want to share everything that matters, needs a system, and everything matters. And just by going through OSHA and HIPAA compliance stuff really raises the game of your team and other things that you do, because you're modeling really good behavior. But walk us through, if travel was okay tomorrow, would you be coming on site for people? Would you be doing virtual or a combination?
It's a combination, even before COVID, because it depends on somebody's budget, for travel and all that. It's ideal to come on site. And we did that with Dr. Samara, who's one of the members here of DN. And I think it's much more impactful anytime you can bring a compliance consultant on site, because they can actually see firsthand what's happening, because they're only going to get the perspective that you're telling them. And sometimes it might be different. You might be forgetting something, maybe you want to tell your consultant the best part, and not show really the behind the scenes. It's like HGTV, it's inviting somebody into your home, your dental practice, to help give you that third party review. And one of my basic philosophies is that I'm there to support the doctor, not to embarrass them, not to, make them feel like they didn't do anything right. Because oftentimes I see these great practices, Paul, where they focus so much on the technology recently, and there's been so many changes and advances there, that the compliance piece, or making sure sterilization and infection control, it's kind of on, like, it's on, what do you call it, on autopilot.
Yeah.
It's on autopilot. And that autopilot, you're staying at this, this altitude, but at the same time, all these other things keep changing, and you miss getting ahead of the clouds in the storm. So I take it from that perspective. So that way, because we just had a conversation with the doctor 2 days ago here locally. She's not going to be able to be at the meeting when I'm there, but her husband's the office manager, and she wanted to know in advance what we were going to talk about. I wanted to be calibrated with her, so when I walk in there to training, that I'm on her team and I'm there to support them. That's my philosophy. So that's an important thing. So we do accommodate, coming back to your question, we do a combination of both. And I let the doctor know that right off the bat, get that relationship going, whether it's remote or it's going to be on site. And then I tell them, we're going to find some opportunities for improvement. And that's how we're going to state it to the team. We do an on site.
I love that opportunity for improvement. Great words.
Very thorough. Next year, you'll see this when we come on site. We do a very thorough mock inspection. We have a whole new tool, Paul. We actually get an OSHA grade and a score, so you kind of know where you're at. And I think we may be doing one remotely. I'm not sure what we decided on, but nevertheless, everybody then has a working document to see how are we doing.
I want to jump in, Linda, because I just want to orient their brain, and you said so much good stuff. So if you're about to go out for a night on the town when that was legal, or a date, or your wedding, or this, you say to someone you trust, how do I look? Give it to me straight. And that person says, really not the true choice I would take. I wouldn't wear my hair that way. And even though that feedback can be not great to hear, you'd rather hear it from your friend than you see your wedding pictures and you don't look right. So I liken that to what you do, because you want to hear from a friend. You want to hear before it's too late. You want to hear from a Rob Montgomery. That restrictive covenant is not going to protect you, or that restrictive covenant is going to burn your nachos. Not when you leave the job and say, oh, geez, I should have never signed it. With OSHA and HIPAA, it's even more that you don't want to hear from a real inspector, oh, you didn't do this. You want to hear from Linda and your team. And I just want to point that out, because you're incredibly kind to begin with. So you always say this in a nice way, but that's the feel. You want to bring you in and just be authentic, Gary V, honest, and say, Linda, what would you do? And I love that idea of opportunities for improvement with your on-site and virtual training. Really good. And what else did you want to finish up with?
I don't want to cut you off. Part of the ROI, Paul, and working with an outside consultant is you want them to be candid and transparent with you, and then you finesse how you handle it with the team so that everybody's on board and you realize that you're going to make some changes. So that's extremely important. So the relationship is there, the feedback, and then you develop this plan. And if we've done policies and procedures, we'll bring them on site that day, or we ship them in advance if we're doing remote training. As Paul said, we did virtual trainings for your team before, because we did that last year, I believe, before COVID. So it's not new to us in our world as far as being a virtual trainer. We've always done that. We're very comfortable in that arena.
Awesome.
But we also, as you mentioned, we become a trusted advisor. So we build our service and check this with your compliance consultant, so that way you have follow-up for the entire year. So our clients, like you all, Paul, that were on a continuing subscription with us, got all kinds of attention and consults and virtual meetings and emails, text messages. over, July 4th weekend, I was working with 3 doctors that had COVID situations in their practice. So we're pretty accessible, during those kinds of crisis situations. So that's what you want. You want that trusted advisor, like the attorneys and,
Yeah, and you need it because
this is,
you're gonna have good thing about you're gonna have needle sticks if you all open, and you know what to do. But when it happens, you're still a little freaked out. Your team's freaked out, but you have a plan in place, and you say, "Hey, do ABC, go to this hospital." With COVID, we're developing this daily. It's like Zoom updates to our Zoom, and we say, "Oh, we didn't know we couldn't go on Facebook Live through Zoom." So that's why you want to have that. Now, I want to switch topics for a question that I've gotten a lot, and it fits with the JBR instead of JBN. So just be nice is don't fight over PFM versus zirconia crowns. Don't fight over fee for service. Dentists, be nice here. But JBR, just be real, is sometimes talking about stuff that's uncomfortable to make things better, to protect people. So early in this process, an associate reached out to me privately and said, my office is not, I'm going to use this example. My office is only giving us level 1 masks. And they said, that's all we need, level 1 masks. And I said, that's not what we need. But I said, why don't you try this? Kindly annoy your boss. Have that uncomfortable conversation. Say, from what I know, this isn't okay. We need level 3 masks, as an example. Can we get, and you know what, Linda? It actually worked. The person got the right thing. So sometimes I'm here. I don't want to get anyone in trouble, but I want people to be safe. I want things to be better. So in a JBR world, as a resource, when stuff is not going right, whether you're an associate in the practice, and I'm not talking about telling on someone to this, where should people go if they see something happening in their practice, they want to make it better, but the leaders are not there? Can they go to you? Should they, before they report someone to OSHA or HIPAA, what's a good resource for them?
Well, I think one of the good resources is first, do some homework on the topic to be sure you're coming with evidence-based information. And it's not just, I don't like this mask, I don't like this saliva ejector, I want something different, I don't like this tool. Come with evidence-based resources, and then, sit down and have a conversation with the leaders and say, there's some things that I've noticed, and I want to, and just it's reframing the whole conversation. That I used that phrase earlier. And I want to use that phrase in relation to a book I read years ago from Dr. Deborah Tannen. I think it was titled That's Not What I Said. So, and when you're getting ready to have an uncomfortable conversation, I would draw attention to that. You may not use that word. You may say, this would be a little bit difficult, but I need to talk with you about something. Can we have 10 minutes? And that way you're setting up the framework. So that way they understand you're looking at the bigger piece of what's going on, and have that uncomfortable conversation. I call it a collaborative conversation.
I like that. One of mine, Linda, is I use this a lot because I have this way about me. Some people call it enthusiasm. I'm very enthusiastic, but sometimes I get overly enthusiastic. So I'll say this, if I'm in my office and we have purple gloves and we used to have blue gloves, and I literally go in and I'm like, my brain says, I don't know why we have purple gloves now. And I talk to one of our lead assistants. I know that if I say, why do we have purple gloves? They don't hear it that way. They hear it as, Paul's mad we have purple gloves. So I actually say this, if it helps anybody with the C words. Hey, I'm curious. I'm not confronting. I just want to know why this. And when I say that, when they hear that, I'm curious, I'm not confronting. And sometimes you are confronting about a safety issue, but I think it's important, especially when it comes to team safety, patient safety. And a lot of times, like an example, you can get wins out of that when you do that. Just to reiterate, Linda, and we'll only spend about 5 more minutes. I know you have to go back to your thing, is just review the fit. Let's say someone's opening an office again. So we're not going to talk about someone's in something wrong already.
Right.
Where are we with the N95 fit test for employees? What would you tell them to do? Is they're going to open up their office tomorrow, on-site fit test, virtual fit test, don't do the fit test. I'll just share a little more about that.
I would say that I would err on the side of caution, and I would be in compliance with the respirator protection standard with OSHA, because at some point you're going to need to be wearing those N95 masks. So I would be planning for that and have that in place so you'll be all set. And that means that you must have a respirator protection plan. If you go to OSHA.gov and search for that, you can find the statute, you can find all the appendices. There's a lot of great information there that can be of service. We created one too that we have. And then besides the plan, then in order for an employee to wear those masks safely, they must have a medical evaluation. Companies like us and others offer it online, so it can be done pretty quick and easy. We just did 2 more people for your team this week, as a matter of fact. And so it's just quick and easy, because then they print out the certificate. So it's confidential. So that way the employer doesn't know how the employee answered those questions. All they have is just a sheet that they've been cleared to wear a respirator mask.
I like that input. And Brett Gilbert, who's an awesome resource endodontist, he talked about, JBN, just give grace to. I just, it's important to realize it's tough on the practice owners. It's tough on the employees. Try to have just a little more mental flexibility about being asked of things, because it's not like the practice owners have wanted any of this to happen, but we're trying our best to follow these protocols that are changing. And I have this book here, which I recommend, the Checklist Manifesto. And what it talks about in this book is, when Sully Sullenberger was able to land the plane and save all the people in the Hudson River, and how he went through this series of checklists. And what I want to point out, which I think never is more important than with OSHA and infection control, is what anyone says matters. So if my front desk person came into the room and said, Paul, I don't really like the shade of that crown, I'm like, could you go back to the front desk? Now is not the time. It looks close enough, right? That's not, you listen to anybody's opinion. But when it comes to safety, whether it's an assistant, whether it's a hygienist or a dentist, be open-minded and say, hey, I don't know if we're using the right things to sterilize this thing. Let's check into this. And they've done this in ORs. They've done this in airplanes. It's important that everyone's opinion matters. Everyone's input matters, and ask them, because at the end of the day, if we reverse engineer, patient safety is most important, along with team safety and us. I just think that's great. So we have a couple more minutes, Linda. I just want to see if we have any more questions.
Let's go back to that real quick for a second. While you're looking for questions, let's go back to that. So I put that under like the collaborative conversations, that everybody should feel comfortable bringing up a topic, especially when they're bringing up, research that substantiates or an article. And this is what should be going on in your monthly team meetings anyway. I recommend that compliance and safety be added to your team agenda, even if it's only a 2-minute conversation, but sometimes it might need 5 or 10-minute conversation. So that way you bring into that culture of compliance into everything that you're doing, not just when there's a problem or when you feel like somebody's complaining. Because my hat's off to all of you, all the doctors, because you've been under so much. I just really applaud all the steps and issues that you've had to, run through. And I'm thrilled to see where you and Jeff and, your practice is back up, doing well.
Yeah, and that's why I just think that this is the time for a reset of some point. It's a forced reset in a lot of ways, but some of the times, I did make a joke in a previous one, and this is a joke based on reality. People say, I'm good with OSHA and HIPAA. I'm like, I got a binder over there. That's like the Nordic track that you hang the clothes on and you never exercise. Like, you have to use the thing. And I will share with you, going through these exercises, here's my recommendation. For every OSHA and HIPAA meeting that you have, order the most fun and fattening food for the teams, because no one wants to do the OSHA part. That's say at least we're getting tacos for that. I think that's great. I want to ask, as we wrap up here, Linda, and Ariel, you can give me the code. I think I did have it written down somewhere, but I want to give the code out in a minute. Also, if you need to reach out to us for any reason, salsa@dentalnachos.com, text nachos, NACHOS, nachos to 215-543-6454. You'll be in our text community. I want to finish up, Linda, with a little bit of just looking at the future and some thoughts. So this is all great. The N95s, the KN95s, the gloves, the gowns, okay? This is like golf balls to play around a golf, gas in your car. What have you seen with the PPE supply chain? We have a number of PPE sponsors. It's been nacho nuts. Can you get masks? Can you not get masks? Just take me through the next 6 months are we going to have enough masks? Are we going to run out of stuff? What do you see?
Well, I'm optimistic, and hopefully I'm being realistic. But what I would recommend as doctors is that you take a good hard look at how fast you're burning through your PPE, and that's what is called your burn rate. So you know how long your masks are going to last, how many gloves you have, and then see if you can work towards having maybe 3 months of supply in advance. That would be one way to be prepared in case there's some kind of unforeseen shutdown that happens or something that we're not expecting. But in some of the mastermind groups I belong to, some of the sponsors, maybe not the same ones here at DN, but I participate with some other folks that are PPE providers and independent folks with their own lines and whatnot. And so they're ramping up their manufacturing here in the US all the time. And they're really doing the best they can to kind of rise to that challenge. And so I think that was one of the things, I don't have it committed to memory. My notes are scattered around from this morning, but that panel this morning really talked about that, really changing how we're focusing on PPE. So I think we're going to feel more comfortable. It's just going to take a little while because flu season's coming, kids are going back to school. We're going to have some hiccups. We might have some minor setbacks. We might go 2 steps forward and 2.5 steps backwards or 1.5 steps backwards, but it's going to just take a little bit of while.
I mean, I think that's important. One of my catchphrases, Linda, is buy extra stuff that doesn't expire. So, if you fuel on nachos like me, buy extra stuff that doesn't expire. that
Yeah.
you can't run your office without. So if I have Drew, my daughter, and we need diapers or wipes, we're going to need diapers or wipes no matter what. It doesn't matter if they're $5 per wipes or $3. This is not the time to let yourself get caught not being able to operate your $1 million practice, 500,000. You will be so regretful if you get to a point. So even I feel like there's been a lot of JVN through a lot of people through all this, which have traditionally sometimes been more competitive. Even suppliers are saying, get it from multiple suppliers, get gloves from this A, get gloves from B, because you need to buy stuff. I was always into infection control with gowns. So we were actually stocked up on gowns like my grandmother with applesauce. So much applesauce. Was that a big popular thing at some point? But you remember your grandmother having these jars of stuff, and that's what you want to do with your PPE. So I appreciate that. I want to give out the code here. If you're watching this live, this code matters. If you're watching it not live, you're going to answer a quiz, but the code is BALANCE814. BALANCE814 is the code for Linda. I really appreciate you sharing with us, Linda. This was an awesome hour. We'll share this with more people, make them feel more comfortable and confident in the time of the coronavirus uncertainty. We really appreciate it.
Absolutely. Thanks so much, Paul. See you soon. Have a good weekend.
Thanks so much, Linda. Get back to your conference. Thanks so much.
Bye.